I'm Sunny Caminero, and I'm a doctor in obstetrics and gynecology. I specialize in gynecologic surgery and cosmetic gynecology. Today, I'm going to be talking about endometriosis, a painful and chronic disease that requires long-term management. I have uploaded a video on YouTube of a surgical procedure involving removal of endometriosis. If you're interested in viewing it, is under my name, Sunny Caminero, and the URL is attached. So what is endometriosis? Endometriosis is when the endometrial cells, those cells that are inside of the uterus, are actually found in other places. These cells typically grow during the menstrual cycle and get shed with menses. However, for a reason that we don't know, some of these cells will actually be found in other areas of the body as well. Endometriosis is a chronic disease that does require long-term management. It is found in approximately 11% of women between the ages of 15 and 51 and is most often diagnosed in women between the ages of 20 and 40. In people with endometriosis, these endometrial cells can be found in multiple different areas, sometimes the muscle of the uterus, the fallopian tubes, the ovaries, intestines, bladder, liver, under the skin, under lungs, which is very rare, the brain, which is extremely rare as well. Not everyone has it in all these places, but it can be found in any of these places that are outside of the uterus. Symptoms of endometriosis is mostly pain. Pain can happen before your period, during your period, after your period. It is described as pelvic cramps, sometimes bloating. Some women experience nausea and vomiting during menses. Some people have heavy periods, back pain, leg cramps, rectal pain. The pain of endometriosis truly depends on the location of the endometrial cells. Here you see pictures of patients of mine in their respective symptoms depending on the endometriosis location. In the first, there's endometriosis in the uterus, and this patient experienced heavy periods, bloating, cramps, pelvic and back pain, leg pain, also pain with intercourse. The next picture, you see endometriosis or endometrioma on the ovary. This causes, again, pelvic pain, unilateral pain where this is located, abdominal cramps. The next picture, you see endometriosis, those powder-like areas in the peritoneum, which is the lining of the pelvis, and you can have a lot of bloating with this. In this next picture, you'll see endometriosis in the bladder itself. This causes a lot of symptoms of urinary tract infection, frequent urination, bladder pain, bladder spasms, feeling like you have to go to the bathroom very often, and this worsens with menses. The next picture is endometriosis of the bowel, and this causes a lot of bloating, nausea, vomiting, intestinal cramps, again, painful intercourse, difficult bowel movements. The problem with endometriosis is that these cells that are found in other places that are not on the inside of the uterus can cause significant amount of inflammation. That inflammation causes not only acute pain, but also chronic pain. It also brings in nerve fibers to the area, so you have more sensation of pain. It causes subfertility, so difficulty getting pregnant, difficulty maintaining a pregnancy, difficulty getting pregnant because the area is very hostile to the egg itself. The ovary is inflamed, the egg is inflamed. It doesn't allow for the fertilization of the egg, and if that egg does get fertilized, then it's really difficult to implant in the lining of the uterus because of this increased inflammation. The fallopian tube also gets scarred from the inflammation, the presence of these ectopic endometrial cells. There's also a small increase in cancer risk of the ovary with these cells, theoretically, because of this inflammation that it's causing. So how is endometriosis diagnosed? The only definitive way of diagnosing endometriosis is by obtaining a biopsy during a surgical procedure. Obviously, we don't take people to surgery just to diagnose endometriosis because we do depend on the patient's history to give us a clue as to whether this patient has a potential of having endometriosis. We can make a presumptive diagnosis of endometriosis on patients when they have a typical presentation. And this presentation is usually heavy bleeding, very severe pain during menses. This is somebody who probably has had very painful menses since she was a teenager, requiring Motrin, Midol, Tylenol, missed school, missed days of work because of pain. Symptoms improve with birth control, symptoms improve with childbearing after having babies, symptoms worsen after done with having babies, and symptoms really worsen in their late 30s and 40s. We can also make a presumptive diagnosis of endometriosis with physical exam. For example, if somebody who has significant pain in the posterior vagina, or if we visibly see endometriosis of the cervix and the vagina. However, that is extremely rare to see. Unfortunately, there are no blood tests that can detect endometriosis. We can use some tools to kind of give us an idea as well if people have endometriosis via ultrasound. If you see a big ovarian cyst that looks like an endometrioma, a collection of old blood from endometriosis. We can also sometimes see adenomyosis, which is endometriosis on the muscle of the uterus. Sometimes we can see adenomas, which is endometriosis in a ball-like shape in the muscle of the uterus. We can also use CT scan, we can use MRI, but again, none of this is diagnostic for endometriosis. We can, however, diagnose endometriosis with surgery. This is usually done with laparoscopic surgery. This allows us to get biopsies and definitively diagnose endometriosis. It also allows us to stage the disease, which is from stage 1 to minimal disease to stage 4 to severe disease, finding endometriosis on the ovary, lots of scar tissue, lots of superficial and deep implants. If you look at my YouTube video of the surgery from endometriosis, that particular patient had significant amount of scar tissue, endometriosis, implants, many different places in the pelvis, in the uterus, the fallopian tubes, and the ovaries. The surgical staging, however, unfortunately does not correlate with symptoms. There are some women who have stage 1 endometriosis that have severe painful symptoms of endometriosis, and there are women who have stage 4 endometriosis who are having no pain and were incidentally found with surgery. What causes endometriosis is unfortunately still unknown. There's a lot of research currently being done in endometriosis, but with all the technology we have, we're still unable to determine what is causing endometriosis. There are some theories as to the causes. For example, first theory is retrograde menstruation, which means that the menses, the period blood, instead of not only coming out of the vagina, it also can retrograde up through the fallopian tubes and enter the pelvis, and thus can seed the different areas in the pelvis, including the ovary, the fallopian tube, the lining of the pelvis, the intestines. There's also another theory is that the endometrial cells move through the blood system to different areas of the body. This can explain how sometimes it can be found in the brain or in the lungs. Other theories is that endometriosis can occur from cells in different areas of the body, just mutated to endometrial cells for an unknown reason. There are also genetic components and sometimes immune factor components. Each one of these theories has flaws, and thus none can really explain the reason why endometriosis occurs. There are different treatments of endometriosis, and this really depends on the patient's age, the symptoms, and the desired fertility. One of the treatments is diet modification. There is no real randomized controlled trials to tell us what kind of foods is better to eat. However, it makes sense that eating foods that cause less inflammation and less estrogen circulating in the body would help with endometriosis. These foods are foods that are low in fats, decrease red meat consumption. Omega-3 fatty acids like in salmon, halibut, nuts, and seeds can potentially be helpful. Increase vitamin A and C and E, which are antioxidant vitamins. The more organic, the better, so that we're not exposed to things like pesticides and preservatives. Over-the-counter medications, Tylenol, ibuprofen, Midol, these decrease inflammation. Hormonal control, mostly with birth control pills, progesterone-only pills, IUDs. These decrease the estrogen stimulation to the endometrial cells. Can also use a combination of birth control and non-steroidal anti-inflammatory drugs. There's a couple of medications, Lupron and Orilissa, and these are anti-estrogen with the intention to decrease the circulating estrogen level, which is what causes more of the stimulation to these endometrial cells and thus allowing to increase pain. Of note, all of these treatments are for symptom relief. They do not in any way cure endometriosis. Next option is surgery. There is literature that does support proceeding with surgery to decrease the number of ectopic endometrial cells after having failed nonsteroidal anti-inflammatory drugs such as Motrin, naproxen, and having failed hormonal control. The surgery increases quality of life because it does decrease pain. The surgical procedure does depend on the age of the patient, their desire for fertility. For example, conservative surgery for someone who is young, teenager as an example, to help with pain, or a woman who desires pregnancy or desires to get pregnant. And this is done by simply burning and removing endometriosis from areas that are visible, also from pelvis, and removing scar tissue, removing ovarian cyst. Unfortunately, these women, approximately 20 to 40%, will sometime in the future require surgery again. Another option for women who are done with having babies or do not desire to have any pregnancy is to do a hysterectomy without removing the ovaries. This can cause significant reduction of pain without having to have the ovaries removed. About less than 10% of these women will then eventually require return to surgery for ovarian removal. The next would be hysterectomy with removal of both ovaries. However, this has disadvantages in that it puts patients in menopause and increases the risk of other conditions like dementia, osteoporosis, and some psychiatric problems. Thank you for listening, and please share with anyone who is suffering with endometriosis, or any friends that may have friends that are suffering from endometriosis. As I always say, knowledge is never wasted. Thanks again.